Service Committee with Queens Community Board 1. Today, we're going to have our agenda regarding the budget for capital and expense. We're going to discuss today, and also later we're going to see if any new business or old business. Florence is going to help with calling the attendance. Florence. I believe she, okay, I will call it. Daniel Alberti.
I'll be one moment, Shahanas. I'm sorry.
It's okay, don't worry. Okay, Jean-Marie. Oh, she's absent, she called. Dean I'm sorry if I don't know how to say her last name. Dean.
Saratovic, I'm here.
Thanks a lot. Okay. Grace Hanway. Okay, not present. Rosemary also, she not well and she will not be attending. Rod, not here too. Judy.
I'm here.
Thank you, Judy. And we have Todd, is a public member.
Here.
Thank you, Todd, and welcome. And also we have who's not the committee also attending with us. Thanks a lot for Christina, Canola, and Deanna. That's correct?
Deanne, yes, thank you.
Thanks a lot for attending with us. And thank you for everyone coming today. We're going to start today our was our agenda with budget. Do you want me to share it? I send it to some of you, and I asked Florence to send it to the rest. I received from Judy the answer for the ranking. Thank you, Judy, for sharing with me. But anyway, I'm going to share it with all of you. Let me do the share screen. This way we'll be able, everyone can see the screen. Okay, I did this one, like I have the expense budget first. And if you see the rank in the left side is how we have it in the whole budget for the whole committee. Like we have 6 under expense. So fast. And 1 under Department of Health, 1 under the DHS, and 4 under DEFTA. This is the expense. If anyone want to share with, like, even if you're not in the committee and you think this something is really important for our community to have it, we can rank it now together and be able to finish and send it to the budget chair, to Amy, and I believe Corinne. This way they be able to finish the rank for all the community board number 1. I will read about number 1 is higher provider additional health department inspector for the community board 1. Last year we have this is in the high priority, like for our community was number 10. I'm not going to put the rank now because if Department of Health, that means is only number 1 for Department of Health because we have only 1. I will change here, like other line, make it easy for all of us. Like since the Department of Health, that means if we rank this one, it will be number 1 because we don't have anything under the Department of Health also. This is for the inspector. Improve safety at homeless shelter. Also for the DHS, we have nothing besides this. And if we rank it as number 1. Let me change the format here. Okay. But also, because in the end, as Florence explained in the start, she said, this year, they have only 40 under capital and 25 under expense for the entire community board 1. Queens, okay? That's mean if we have in the expense here like 6, and I believe will not be going all the 6 together to the community board in the meeting to be approved all of them. I believe is my opinion, but still is you can share with me your opinion. After we finish all of them, we can see like which one, if we have to take it off from our list, since we have to only be at 25, and we put our notes, okay, this is number 1 by the agency, but still since we have other agency, we need this is our priority, we can choose also to change a rank, okay? Please, if you're feeling you want to interrupt me, ask a question, put a comment, raise your hand, or even unmute yourself. Okay, now we're going to the DEFTA. Before I start with DEFTA, Florence shared with us before the meeting start. She was in the meeting and the Department of the Agent asked her, let me read what they said. They request funding for scam preventing education for older adults. And they said, like, if we can put this in our expense. We can add it to ours. We have 4 this year already from last year, brought it to this year. But if we need to add this one, we can add it also to our rank this year. Okay, let me read the first one under the Department of the Agent. Provide additional senior center staffing. The other one, funding for new senior center in Astoria Heights / Detmers Boulevard area. The third one, programming in the community board 1 for senior training in technology for health and mental and social needs of the elder population. The last one under DEFTA, My Right Taxi Program is a taxi pilot program used to be under DEFTA. And they said this one used to be funded by the federal, but they cannot fund this one because this fund was ending. This is the expense. Can we work together in the expense before to go to the capital? This way we can rank it and see how we want to have in the end, send it to the committee board. Anyone want to start?
I would rank the taxi program higher than it is right now, because if it's not funded by the federal government anymore, we should continue that program. I don't know how others feel about it.
Okay. What about anyone, even if you're not in the community or the committee, you can share your opinion. This is for the community and for the seniors, for all of us. Thank you, Dean. Yeah, I see someone. Let's see who says.
All that you needed, all the right things. Whoever's writing this script is doing.
Someone has opened.
I agree. I for some reason I couldn't unmute. I actually ranked that as number 1 also. The taxi program.
Yes. Thanks a lot, Judy. Okay, who's calling from the phone ending 1005? Can you
Phyllis,
say it again, please?
Phyllis,
Did you hear it, Florence?
That's Phyllis Para. She's a board member.
Phyllis. Oh, hi, Phyllis. Thank you. Thank you, Phyllis. Okay, Florence, you want to change the name?
I'm going to try to do that. Thank you. Yes.
Right.
I haven't done it during the meeting, so bear with me. Close this.
Don't worry. Tell me the spelling and I change it.
No, Phyllis.
Phy. Just a moment. Phyllis, you said?
Yeah, it's fine. I can do it. I got it now. You want me?
No,
You do
because I don't.
PHYLLIS.
LLIS. Okay, let me change it.
That's fine.
Thanks.
I don't have a co-host. They didn't give
okay.
me co-host.
LLIS. Okay. Yeah, I don't like to leave the telephone.
Yeah, me neither. Perfect.
Thanks a lot. Okay, now as Judy and Dean agree with us about the my right to be number 1, we're going to change the rank for this one to be number 1. We have another 3 under DEFTA from the old, and then we get Phyllis, I'm going to mute you, okay? And when you want to unmute, you can press, I believe, *6. I can remember now, but I can check for you. I have long time I didn't use this kind of stuff. Okay, I mute Phyllis. Sorry, everyone. Now we have another 3 under DEFTA because we do it now by agency. We have the new senior center in the Astoria and more staff in the senior center, and also the training in technology for health and mental and social needs. Anyone want to help in this?
Hi, Deanne here. I'm on the Environmental and Sanitation Committee as a public member. Um, I'm just going to weigh in and say that I feel like staffing for important things is low everywhere in the city. So I'm not familiar with this particular issue, but I would always rank staffing as pretty important, especially when it comes to our seniors.
I agree with you. I want to share with all of you. I work as a program director for a senior center, and staffing is the big issue in not in only our center, in all the senior center, even in the entire city now. When you come to staffing, is the issue, and this is why it's slow the work, and even stuff like when they are work, they can if they have more skills, they help in different area. Sometimes if they good in computer, now you don't have to get the fund to teach computer because the staff has the experience in computer. If the staff has like experience as a social worker, they can help with mental health and when they have the classes with the seniors. I feeling staffing is really can be number two, but I don't want to do this because as a program director, I don't want to do this. This is why I left it for all of you.
I would agree with that. I would rank staffing number 2, and then I would rank training for seniors number 3, and then the senior center number 4. I mean, obviously we do need a senior center. I just don't know how realistic that is going to be. So I'd rather use the funding for stuff that we can possibly get
Yes,
funding for.
I agree with all of you. Thanks a lot. Okay, now as we rank, now we have the 4 rank for, we have one more from the request today, Florence shared with me regarding the scam preventing classes. Do you want to put this or we leave it with the training and if they can do the training, Florence, do we can update the one for training for technology for health and mental and we said also scam preventing because it's still classes.
Yeah, that's
So-
actually
so
what I was, gonna suggest is that instead of adding, we just expand the training to include the scam prevention.
So here's the thing.
Yes.
In my experience, everything should be broken apart. So if you're asking for lights and benches for those are both DOT items, they don't go in one choice. You have to be very specific with the agency. You may get one, but you may not get the other. But when you put them together, you have a less likely chance of getting any of them. So you and your committee members should discuss if you want to add it, and if you agree that you want to add it, where you want to put it, what its priority is. It would be better to have 6 and have it separate than have it 5 and have it crammed together.
Okay. Since also this, I want to share like the police officers also do classes in this, provide a lot of classes, and they have a like a team, call it safety.
Team,
What you said?
team.
No, besides
Oh,
this, they have a safety something I can remember now, a safety zone or something, and they do this one. I believe in instead to give the fund in this area and the police officer already do it, we can keep it this way this year. What is
Okay.
everyone? Thank you, Cornell. I see Cornell agree with this. Anyone else?
I think that's fine.
Okay, we keep it this way. Now,
I agree.
yes.
We should keep it as is.
Thank you, Dean, for respond to this too. Thanks a lot. Okay, since we agree about this, now we have the 6 expense. Just in case if we have during all the committee chair meeting, we have to remove something from the expense because in the end, we have 25 for the entire community. Now, if we have to remove from this 6, what you feeling, what the priority and what the lower one are, we have to take it out. Like,
I would say the senior center, because that's very unlikely.
okay, senior center, let me take this down to put it in the remove if we have to remove.
And I
senior
think that's our 4th one anyway. So that is the
Yes.
lowest on the
Okay,
list.
I will do because I like by colors. I will put it red. That's mean well gone. Okay, after that we have like I will share again. Hire provider inspector in the department for the Department of Health. Improve safety at the homeless shelter. Provide additional senior staffing. And programming, senior training, my right. Which one you want it to be number one in all of this? Or the list, if you want to start from down.
What are you asking again?
Like for our list now, we have 5 in expense. And if just in case, if we have to reduce this number, when we are in the meeting with the whole chair budget and the budget meeting, if we have to remove something else, what the other one we want to remove it? Just in case, because we don't know, it's 25 for the whole community. I don't want to go and take the decision by myself. I like to share it with all of you first.
I mean, I don't know. I feel like all of these are important. I don't know what I would remove, honestly. I mean, the top 5 that we have here, I would push to include them if we can.
I will push too, but
Can we leave them on the list, Florence? Because then once we look at
Yes.
all the other committees, and then every committee then as a whole, or all the committees as a whole, should look at the overage, let's say, and then
Yes.
prioritize that, because we could be taking off something that's more important than another committee has, and they're not taking theirs off. So should we
Agreed.
eliminate now, or should we just, wait and see if we have to eliminate and then you make the decision?
Not every single committee is going to have a capital and expense list. So for example, so you're aware, the Consumer Affairs Committee only has 1 item on their list. So the numbers should be respectable. We will probably still have an overage. My anticipation is that our board will have an overage. But you're prepared by telling them, okay, of our number, if we have to lose one, this is the only one we're willing to lose. Because you do not have an excessive amount of numbers. Your preparation is spot on. Last night's preparation was excellent, and tonight's preparation is excellent.
Thanks a lot. Okay, that's mean we leave the expense this way. Now we move to the another one. Let me move this here. Now we go to the capital one. Okay, let me get this down again. Okay, capital one, we have, sorry, sometimes go fast. Capital one is easy, only 4 items in capital one. 1 under the DHS, the other one in HHC, second one in HHC, it's last one in under DIFTA. The first one under DHS is provide new homeless shelter and upgrade existing facility. The second one in the HHC, provide a new or expanded healthcare facility. The second one in the HHC, renovate or upgrade an existing healthcare facility. The last one, and will be under DIFTA, renovate or upgrade senior center across the community board 1. Okay, how you want the rank? We're going to start.
I had a question about number 3, the one
Yes.
that about adding the Florida Sinai. Sinai is not a health and hospitals facility. I didn't know if this was a mistake, or like health and hospitals would not fund a Sinai facility.
Okay, I see Florence's hand. Florence, you want to answer this question?
Yes, please. So Mount Sinai Hospital is the only hospital in our boundaries. We do not have a health and hospitals in our boundaries. Our health and hospitals is Elmhurst Hospital, which lies between Community Board 3 and Community Board 4. The reason that this request is on our capital and expense for Community Board 1 is so that the New York City Council sees this request. Then, when Mount Sinai Hospital Queens goes to advocate for money for Mount Sinai Hospital, the council knows that the community wants Mount Sinai to receive this funding because this sixth floor that they're looking to build is very, very important to the community. I'm going to go a little bit long, Shahenzad.
I leave it for you.
When COVID actually happened, Elmhurst Hospital became incredibly popular because of the fence across the street with the message made with the red cups. At the same time that Elmhurst Hospital was going through the crisis of COVID, so was Mount Sinai Hospital, our hometown hospital. And they didn't get the recognition and press because they didn't have a fence that had words written in it. Many, 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 many people from our community died, and Mount Sinai was the one who was saving our people. So by having this on our capital and expense, it gives a message to the borough president, and it gives a message to the council that that hospital needs our help.
Thanks, Florence, for the clarification. I have a question, Florence. Last year, I heard this one was approved to do the ICU.
Not yet, not
Not
yet.
yet?
Not yet.
They
It
are,
hasn't been done.
they're looking, it's a very, very expensive. So they
Yes.
are looking to do it because the ICU needs to be expanded and upgraded. But, you know, it's always in the works. It's budget time now also at Mount Sinai. So I'm sure it's on the agenda. And then they do the same thing. They look at all their facilities, just like the health and hospitals does. So it's, you know, it's on their wish list and it's closer than ever. And I will tell you, I used to go to the council for the hospital, and it definitely does make a difference. That's how we got a lot of our updated equipment, et cetera. And I used to do the appeal. So it does help. It does help the hospital. I mean, I'm retired now, but I can share with you that once the council is aware that the community is looking to upgrade the facility, it does help us, as Lauren said.
Yeah,
And I want you all to know, and I'm going to jump in, I'm sorry, Judy was the first ever woman COO of any hospital. And Judy's years of experience are amazing, and what she's forgotten, we will never know.
Well,
yeah, I was just going to say, Judy used to be also the chair for the Health and Human Service.
Yes.
I remember I used to be coming to all her meeting, and I learned a lot during her meeting. Thank you, Judy, for all
But
the
anyway, I'm just saying, he's very right that the city they don't always like to give to not-for-profits and not health and hospital, but they still do, the council still does give money to the not-for-profits. There's a whole day of appeals that goes on, and everybody pleads their case, let's say. So this can be something on here, and they're not going to give it to us, but it brings attention to the cause.
Yes. Okay. Thanks for that.
Thanks for explaining that. That made a lot of sense. Thank you.
And also, Todd, this is a wish list, and a lot of people don't understand that. We don't have, throughout the borough of Queens, we don't have enough hospitals. Not for the amount of people we have.
Oh, no, definitely not. I mean, 25 have closed in the last 25 years for the city, so we're definitely underserved.
Okay, as you see in the left hand, everyone, in the rank, the one already in the budget, the hospital, it was upgrade the existing facility. Yeah, it was number 47. The one for the expand healthcare facility, and this about provide a new expanded health care facility. Our district is in the dire need after attention to determine. I believe like they asking for another facility. We
Yes.
agree. This is 100% we still need it. I
Yes.
believe this is like will be for my opinion, will be number one priority. Because we still, we need more healthcare facility.
We need a trauma center down
Yes.
by the waterfront, and when the big, huge developers come in, that is something that, as district manager, I've mentioned over and over again to the borough president. My hope is before I die, I get to see another hospital built down by the waterfront.
Yes.
So
I
That
those
would be
two,
amazing.
yeah, because
those
we have a lot of,
two,
yes.
you would rank 1 and 2 under health and hospitals because they're only for health and hospitals. The old numbers are not affecting you. You would figure where you want to put the numbers for health and hospitals. Then
Yes.
Department of Homeless Services, the Department of Homeless would have a separate ranking, 1, 2, 3, and DIFTA would have a separate ranking.
Yeah, because I have only one under DIFTA and one under the
Site.
DHC, yes. DHS.
Perfect.
Okay. Also, now we have 4 capital, I believe, and all of them is very important. Nothing we cannot remove it. By this, I believe we finished the ranking. Let me save because I don't want to lose anything we say today. This is what we decide now. Everyone is agree about this? Thank you, Todd.
I'm kind of new to the
Yes.
process, so I'm sorry if I hold things up, but on the first sheet, how were there several number ones? Could you explain that to me?
Okay. This one, the expense.
Yes.
Okay, in this one, we have one under the, because this year we do it by agency. We not do it by the
Got
whole.
it.
Okay, got it? Okay, no problem.
Thank you.
You're very welcome. Anyone else has any question, please? This was fast.
Can I see the list for capital? I'm trying to take the notes.
Okay, let me go.
I apologize. I
That's
was
okay. And
slow.
also I will share after we finish, how is it? The DHS, we have it, since one
DHS
is number 1 because it's only one item.
shelter and upgrade. Expand healthcare is number. I can't see.
Which one? The
H&H.
14 and 15?
Which order is H&H? Upgrade
H&H.
existing healthcare is number
2. Upgrade is
2.
number 2 and
New
expand
is number
healthcare
1.
number 1.
Okay, got it.
And DEFTA is number 1 since it's only by self.
What is it? Wait, just bear with me. DIFTA. Renovate senior centers. Okay, got it.
Good. Okay.
Yeah.
Anyone, before I stop sharing my screen, any more question about this one? We agree this is how we're going to take it to our share community for the budget.
This is good to go.
Thanks a lot, Dean. Thanks a lot. Okay, I'm going to stop sharing. Now we go back to now. Okay, was so easy. Like, I'm happy. Thanks a lot for all of you helping. We have Phyllis come again. Let me admit her. Okay, thank you, Quinelle. Thank you, Todd. Thank you, everyone, for making it so easy for me and for all of us. Now, for new and old business. Anyone want to talk about new or old business? Nothing. You want to share anything? Okay. Again, I will share again what Florence shared it. And just in case, if they have enough space in the expense budget, I will share it with in the meeting. The scam preventing training for the seniors, I will share it, but I will not put it in our ranks this way. Let's see how it's going to work first. Okay. I see Christina raise her hand.
Christina Chase raised hand, it looks like.
I'm muted.
Thank you. Thank you. I don't know if I'm wondering if maybe if CV1 would be interested in working with some community-based org to maybe do a community health fair with Mount Sinai.
We already do it through United
Okay.
Community Civic Association. They just had it last weekend.
Oh no, I missed it. Oh no.
I attended.
Okay.
It was so good.
30 years they've been doing it.
Yeah.
Oh, okay.
Huge
Well,
success.
It was
then
success.
maybe Shahanaz, we can talk about doing one in Ravenswood.
I do it every June, and we
Okay.
do the big one. We have over 40 something vendors. Once I not coming, the breast cancer department, a lot of people coming from Mount Sinai. And also we do another one in February because February is for heart. And we invite Mount Sinai, we invite a lot of, we invite the clinic, but now I don't know who's work in this clinic in the one in 21st. We used to invite them. But right now the person changed. I don't know. But the other person who work with us now, the floating hospital also,
Mm-hmm.
they work because floating hospital also is the one for our community more now.
Mm-hmm.
And the people like
Mm-hmm.
the stuff they do it. And I asked the floating hospital if they want to come to our meeting, to contact Florence, and they said they will work in this, but like shorten stuff make issue to everyone.
Yeah.
Yes, thank you, Christina. And if you want to do something, we do it, and the seniors like it when we do any health fair in the community. And also, since Quinella here, if we do any health fair, Quinella said she will be the outreach for all this kind of stuff and do the communication. Maybe we do something and we have everyone. And Florence, we're going to ask you for the giveaway.
So we don't step on other organizations' toes. We let them take the shine and the leadership. They do all the table setup, reach out to the vendors and everything. We're not a civic group, and there's a big misnomer with new board members that we're a not-for-profit or a civic. We are actually a New York City agency. While if you as an individual wanted to reach out and join Shahena's programming and do volunteer work that way, but we're just an advisory board. But here in Astoria, God bless us, we have civic groups, not-for-profit, other organizations that do that, and we don't step on their toes. We never have in the past.
Can I say something? I don't know if it's about stepping on toes. I think it's more about letting people joining those organizations, like sitting out there with a table and just trying to get the community to know more about what your office does. That's what I think it is. So I don't know if it's
What
about
you're
stepping
talking
on
about
toes.
is something different. I'm talking about
No.
sponsorships and putting our name on top of
Oh,
things.
no.
You're talking
I
about
don't think.
something completely different. You're talking
Yeah.
about promotion. I'm
Yes.
not talking about promotion. I'm talking about allowing other civic groups to shine. I'm talking about something completely different. I'm sorry.
No, I thought when Shahanaz mentioned that, we can get out there in the community and do some outreach, I thought that's when you made your comment. But I just wanted to make sure that, I didn't get misunderstand what you said. Thank you.
No, not at all. Thank you.
Thank you, everyone. Yes, outreach, I feeling is like any kind of outreach for any organization or even for agency, for anything, is really helpful. Is make the people know about the community, and we will also benefit all the time from all this outreach. Is not only we the one get the outreach for our place, but the benefit coming for anyone is really good. The example, once I know when they did the health fair on the Saturday, I believe I went Saturday, is like you check your blood pressure, you do the massage, you do the what you call it, the cholesterol, the sugar check, everything was for free. Besides, you get a lot of free stuff. You get the banana, you get the fruit, you get the breakfast this day. We have an entire group of the seniors went and we eat breakfast together, and you take the kids. It's really good day, and everything was provided for free. But they also remember they have their own budget. They have to also work in this situation because they have to have staff to work extra days and all of this. Like we have to help, and we'll see even when we get the benefit also. Phyllis, you want to say something?
No.
Okay. No, I saw you're like you're going to talk. This way I'm asking. Thanks so much.
Oh.
Okay. Anything beside what Christina said about the health fair and the outreach? For all the new business, anything? I don't want to take anyone extra time. I believe we did really good with the budget, and thank you everyone for attending. Thank you everyone for helping today. And I hope so have a really peace night, and stay well, everyone. Thanks a lot.
Thanks, everyone.
Thank you.
Good night.
Good night. Bye-bye.
Thank you very much. Good night.
Good night. Thank you. Good night.
Thank you.
Thank you. Have a good night.